Hello, my name is Jen Vedder, and today we're going to talk briefly about leadership and management in healthcare. Our learning objectives for today are as follows. We're going to define the difference between leadership and management. We're going to discuss what the different leadership theories are and what could make an effective leader in healthcare, and we're going to describe how these leaders can motivate their employees in order to manage them effectively. Well, before we can get into any of this, we first need to define what a leader is. Well, a leader is someone who can get people to follow you. That's basically the bottom line. A leader uses their authority appropriately to meet objectives of an organization. A leader is able to unite employees in order to serve the vision or mission of the organization, and a leader sets the example. Leaders put their employees' needs ahead of their own. Well, what could be the effective healthcare leader? Well, this is someone who's an independent thinker. They're passionate about the customer, or their patients in this case. They motivate and inspire. The cartoon on this slide is kind of funny, but it makes a great point. We don't always get it right on the first try. Experience sometimes means failing, but the quality leader will take that failure and learn from it. They will take the time to make sure others don't make the same mistakes. This kind of self-actualization isn't inherent in every individual, and many times it's what can make a person an excellent manager but a mediocre leader. Sometimes we fail before we get it right, and it's how we react to and overcome these failures that can make the difference for our employees. Today we're going to look at 5 different leadership theories. There are other theories out there, but for the purposes of this discussion, we're going to focus on these 5. Let's start with participative leadership. The places where participative leadership works best are situations where group members are skilled and eager to share their knowledge. It's also important to have plenty of time to allow people to contribute, develop a plan, and then vote on the best course of action. These participative leaders find it useful to use this style when a leader wants to get everybody to agree on something. It's kind of like a democratic method. It doesn't always work well if you need to make a quick decision, however. The transformational leadership style focuses on a leader that actively communicates with employees to motivate them to increase their productivity and efficiency. Transformational leaders engender trust, they seek to develop leadership in others, and they exhibit self-sacrifice. They serve as moral agents. They focus themselves and their followers on objectives that transcend the work group's more immediate needs. They tend to look at the big picture of things. Laissez-faire leadership. Well, in French, this term means let it be, which best describes this kind of leadership style. Such a method involves leaders delegating decision-making and tasks. I personally have a lot of experience with this kind of leadership. As a consultant for a government contract agency, I work as a telecommuter. My boss is what we term in the Army a fire-and-forget kind of leader. He gives me a task, and I execute it. I don't need any additional help to get my work done. I don't need him looking over my shoulder to make sure I'm dotting my I's and crossing my T's. I do what I'm told to do, but if I need help, I know he's available to assist. The authoritarian leadership style is particularly useful for those leaders who tend to know more than their employees, and it works best when there's no time for group decision-making. If employees are particularly talented and experienced in their own right, this kind of leadership style can be limiting and stifling for them, and they may resent their leader. Again, I'll use an Army reference. On the battlefield in combat, the company commander is the one in charge. He makes the critical decisions when needed. There's no time to huddle up and discuss the options. It's a clear chain of command. Traditionally, leaders in healthcare are servant leaders. Not always, but as we'll discuss, servant leaders kind of tend to be in the healthcare field. The healthcare industry was created with the primary purpose of serving the public. Given this, the servant leadership style serves the healthcare industry very well. But of course, it isn't the only way to lead, as we've seen. Servant leaders are very focused on people, their employees, and the customers or patients they serve. It's important for the servant leader to serve his or her group. This is where servant leaders are very effective. They have a genuine desire to help. Servant leaders are successful when they meet the needs of their employees. How we motivate our employees is vitally essential to the outcome of the work they produce. But really, why is this important? I mean, they get a paycheck, they get benefits if they're full-time employees. Why do you have to do anything else? Well, in order to get employees to want to help achieve the goals of the organization, we need to make these goals personal. We must show employees how their role in the overall goal of the organization is important for mission accomplishment. This starts by clearly defining the goals in terms that everyone understands and can relate to. Each one of the employees needs to buy into what the organization as a whole is trying to accomplish and how this relates to their specific job. Leaders will make these goals meaningful and personal. All right, so let's talk a little bit about management. Management is the act or skill of controlling and making decisions about a business, a department, or a sports team, things like that. Management is the act or process of deciding how to use something. Managers are tuned into the day-to-day business and making sure that everyone is following the regulations and instructions at hand. Managers are technically competent. So can you be both a good leader and a manager? Well, sure. But can someone be the best manager but lack leadership qualities? Absolutely. Leadership in healthcare requires a different breed of individual. There are many tasks to be mastered at the leader level, and it's important to understand who it is you're leading as well. In healthcare, we find that we have a very diverse workforce and different backgrounds and different education levels, and it can be tricky to figure out what keeps all your employees headed in the right direction. This is why knowing how to effectively lead and manage is so very important to carrying out your organization's mission and vision. Leaders and managers may focus on different things, but in the end, they both want to achieve the common goal for the organization. Leaders are focused on things that are external to an organization, and managers are focused on more of what's internal. For example, leaders are focused on getting their soldiers through battle, making the path clear for everyone to follow, showing them where they need to head in order to get the job done. They inspire and motivate. Managers are tuned into the day-to-day business and making sure that everyone is following the rules and regulations at hand. So you may ask yourself, can I be both a leader and a manager? Well, yes, and many times you have to be. So let's summarize real quick what we talked about. We defined the difference between leadership and management. We discussed servant leadership and the 4 other leadership theories. And we described how leaders can motivate employees in order to manage effectively. Integral to whatever kind of leader you become will be your ability to connect with your employees and followers. The healthcare industry pushes in a very customer-focused and patient-centered kind of situation. To get people to do what we want, when we want it done, and to inspire them to want to do it, we must look deep within ourselves, define our leadership style, and be consistent, trustworthy, fair leaders to all employees. I like this quote from Dwight Eisenhower. The art of getting someone else to do something you want done because he wants to do it. Here's your in-class assignment. Today I want you to take a few moments and develop your own personal definition of leadership. What kind of leadership theory of the 5 we've talked about today defines you now? Think back about what may have defined you 10 years ago. What experiences have encouraged the change in your leadership style? If you haven't changed, why not? Do you need to? Is it what you're doing effective? Do you think your leadership style is going to motivate your employees into action? If you're already in a leadership position, is it working? Let's take some time to go through and think about this. But before we do, are there any questions? Thank you for your time. We'll go back and take a look at our in-class assignment.